I'm Dr. Ann Hobbs. I'm the director of the Juvenile Justice Institute at the University of Nebraska at Omaha. And I want to talk to you a little bit today about evidence-based practices that we're employing here in Nebraska and some of the ups and downs that we've had, especially working with communities. It's been very fulfilling. But before I get started, let me just say thanks very much for inviting me to this summit. It's really exciting to watch another state go through this process. I can't wait to see how it all works out for you. And I hope to meet you all in person someday. So as an overview of this session, I'll be talking a little bit about Nebraska's community-based aid fund because that's a really important piece. That's kind of the backbone through the legislature. I'll talk about how the university has been involved in building the juvenile case management system. Also the types of programs that contribute to JCMS, evaluations we've been able to do, and then some of the data integrity work we're doing, as well as obstacles we've had, because there's been a couple of those. I'll start kind of at the beginning with community-based aid. This fund, our legislature had the foresight about about 20 years ago, to set up a pot of money that communities can access, and they can use those funds specifically to work with juveniles and hopefully prevent them from getting involved in the juvenile justice system. So communities, in order to access this particular pot of money, they have to have a community team. Usually the individuals that sit on that team are like the prosecutor, public defender, law enforcement, probation. Sometimes judges will sit on the team, not as often. A lot of nonprofit agencies or mental health providers. So it's kind of all the key players. Education is a big entity at the table. And so the community will bring together all of these individuals and they'll plan for what's best for the youth in their community. So Nebraska's been doing this for, like I said, about 2 decades. And the university wasn't always involved in that process. Early on, they would reach out and maybe consult. Like I wrote one of the first community plans in Nebraska. That was awesome. But so they would work with us kind of one-on-one there, but there wasn't a really systematic way of working with the university. So if you fast forward to 2014, that's really when JJI began working with the legislature on kind of what is a different way we could structure this arrangement or this community-based aid fund to have, more accountability. Part of the issue was we didn't really even know how those funds were being spent across the state. Maybe an accountant somewhere knew, but as a general practice, we didn't know what those were being spent on. We didn't know whether they had good outcomes. So that was problematic. In 2014, our legislature decided that in order to access the funds, they told communities that every community had to have evidence-based practices that they would fund. So communities went out and did what they would do. They went and found evidence-based programs kind of online and plugged these in. And what we found is really JJI evaluated that process, and only 3 out of about 200 programs really met the definition of being, quote, an evidence-based program. So they were following the model to fidelity. They were using it on the right population, the one it was designed for, and employing all of the pieces and the correct dosage. And so what we found was that wasn't really the right way. I mean, the legislature really wanted there to be some accountability, but that wasn't maybe the best way to go about it. So the following year in 2015, they worked closely with JJI, with the Juvenile Justice Institute, and I'll explain in a minute who we are. So they worked with the university, they worked with JJI, and we decided that really to allow communities this flexibility that allows them to plan for their own youth, we want them to just put in individual cases into this case management system, and then we'll evaluate whether or not those, what they're trying to do is effective. So if a community says, look, we really have a truancy problem in our community, then employ an intervention and we would expect the youth's attendance to improve. So that was really the model that we employed in 2015. That required building a juvenile case management system. You'll hear me refer to that as JCMS. So far that's been really successful. We have a lot of different resources, which you'll see in a minute. And there's been a lot of challenges. So it hasn't been easy, but we've begun to do some evaluations, and starting to explore like how well do various different communities use the definitions uniformly. And so real quick before I get too deep into this, I'll refer to JJI, and really what that is the Juvenile Justice Institute is an institute within the University of Nebraska, Omaha. We focus specifically on juvenile issues. We were created by our legislature in 2002, really completely separate from the Community-Based Aid Fund. And so our role is to advise on policy issues. So anything from, solitary confinement to how does the sealing juvenile records help youth. So generally we kind of stick to more policy issues. But what we found is over the last 20 years is that we are called upon to do a lot of evaluations of programs. Like programs want to know, is what they're doing, does it work? So it really aligned nicely with the Community-Based Aid Fund to kind of marry these two projects. And now our role since 2015, we've been written into statute specifically to measure whether or not programs are effective at what they're aiming to do. So what do I mean by effectiveness? If you can see measuring effectiveness in a fragmented system. Before we came on board, I did evaluations for individual programs, but really it would depend on how that program defined the success, right? So measuring effectiveness in a fragmented system is really problematic because if I were to do two evaluations of two diversion programs, and let's say they're fairly similar, they serve the same age of youth, they serve predominantly shoplifters. If one county attorney says, in my program, it's successful if a youth does 75% of their diversion plan, in the other community, the prosecutor says, no, the youth has to do 99 or 100% in order to stay out of court. What you can see right away is one program is going to look like they're less successful when in fact, they're not. They're probably about the same. So without having uniform definitions and uniform measures of success or uniform measures of recidivism, we really were doing evaluations and, as researchers, we would read them, but in programs, they might think, hey, I'm doing great, but compared to what? So measuring effectiveness in that kind of system, it was unclear which programs were funded. We didn't have established outcomes, inconsistent definitions, and then we had no idea really whether or not services were effective. The other thing is to be totally honest, we just didn't even know what we were funding back in those days. So that was roughly 2013 and earlier. So if you look now at the screen that has kind of a diagram, what you'll see is that in how the system used to be, data would feed into the Nebraska Crime Commission, but it didn't connect to anything else. And so even if independent researchers did evaluations, we had to go out and somehow marry these systems. So the court system is where we would obtain records for anything filed in court, and then the Office of Probation is for any youth adjudicated to probation. And so none of these systems kind of were linked together or spoke to each other. They don't speak to each other very well yet either. So don't get your hopes up on that one. So how the university, what we did in 2015 is we decided, okay, we're going to ask every community to submit individual level data. And there has been some pushback on that. But we wanted to know, we wanted to be able to answer some basic questions. And basically that's what are we funding? What are some of the programs we're funding? What are the goals the program has? Do we have common definitions on this? And then can you enter data in a way that we would extract it and be able to compare diversion programs across the state? So that was the very initial goal. We had to get more in depth, which you'll see in a minute. But if you go to the next screen that has the diagram on it that shows the community-based aid program, so that round kind of circular icon at the bottom, those are our community-based programs, and we have about 250 different programs that are funded through this particular pot of money. So all of that data does feed into the Crime Commission. However, we don't get, sometimes that data source has, it'll have demographic information or dates of service, but it doesn't always give us the full picture. So you'll see they also send data to JJI directly. And then we still have the entities like education and law enforcement agencies that submit data to the Crime Commission. And so that's still a little bit fragmented, like it doesn't fit into this picture exactly yet. We're hoping someday these will all come together a little bit better. But right now, what we are able to do is we are able to take the data from the community-based aid programs and merge that with court data and probation data. And so we bring that all into the Juvenile Justice Institute, and then we have evaluators and researchers here that help us analyze it and help us look at long-term outcomes. So you might be asking, like, well, how can you have the same outcomes for 250 programs? And that's a great question, because you can't. So what we had to do is we started this process by cataloging what type of program and what is it that you're trying to do with your intervention. So if you go to the screen, this program level variables, what you'll see is on the screen, I've tried to include the icon when I'm talking about a specific point in the system. So this is specifically all of our programs out in the field. What we needed to do by starting, we needed to know, what is it that what's your modality? Are you a class? Are you a group home? Are you an after school intervention? Kind of what is your intended modality? And then we had to ask some basic things, like at the program level, do you assess youth? Do you have well-trained staff? Do you serve high-risk kids or low-risk kids, or kids that are, in the child welfare system? So all of these different pieces really feed into success, right? Because if I'm a program that's serving super high-risk kids and I have high staff turnover, those are two potential explanatory variables that don't really, if I have bad outcomes or outcomes where youth end up deeper in the system, it could be that I just don't have enough staff to run my program. So we really had to look at program level variables, but then also we had to work with the programs on what type of what data to collect on them. So if you think about a diversion program has very different outcomes than a truancy program. Diversion program is primarily designed to keep youth out of court and to have the youth learn from those actions, usually through like individual case plans. A truancy program may use some of that same mechanism, but their primary goal is to get youth to start going to school. And so, or let's take a family support program. A family support program, their goal is to build the cohesiveness of the family and have that be a healthier family dynamic, maybe. Or a crisis intervention program. Their goal is to address the immediate crisis. So as we started working with these 250 programs, what we had to do to start was really to catalog them to get everybody in the category that fit them. So are you a diversion program or a diversion program or a truancy program or a crisis response program? And then we went and we did our best poll of the research to figure out what does the research say the best way to intervene for truancy? What is that? And then we met with programs again, and we did all this via webinars. And we met with programs and we asked them, okay, we're going to measure attendance pre and post. Is that going to work for your community? Is your school going to provide that data? And are you going to be able to input that data? And then, so we went through each of the variables. Literally, we showed them on the screen. Then we started building the system. And then if you go to the next screen, you'll see, literally, we had them test. We built a mocked up system. We had them test it and enter some data. And then sometimes they would come back and say, oh, no, we gather race and ethnicity different than this. So it was a very iterative process. For the different program types, it took about 2 years, at least. And we were constantly kind of building and discussing and revisiting and fixing. And that's been actually one of the obstacles is in working with some of the programmers. I think sometimes there was a desire to just build the screen and let it set, and why can't we get it right the first time? And the pot of money was really designed to that the legislature, like the view of this from the very beginning was to have some flexibility to allow new programs to come about, which would require new screens to be built, and to allow programs to change, right? So if we can improve our programs, then we need to change our data. So we built these screens, but at the same time, if you look at the page that's entitled Resources for Programs, we also had to create user manuals, and we've done some video training, some technical assistance. We also have a person in our office that programs can reach out to. I was going to say any time of the night or day, but no, that's not true, 9 to 5. And then we try to put some of the, research articles that have been done, some of the research that's done is parked out on that page as well. I will say I don't think it's anywhere as cool as you guys' website, but you can visit our website at www.jjinebraska.org, or you can go through the university, JJI, and you'll get to Evidence-Based Nebraska. So the name of this project is Evidence-Based Nebraska. The types of programs that we work with right now, you'll see a listing on this. We have basically 77 to 100 different program types right now. And so 22 of them are like diversion programs, about 21 are truancy programs. We have some after-school programs, some mentoring programs. So you can read that through that whole list. Well, this changes every year. Every year that the funds are redistributed, we have to kind of shuffle and see what's being funded. So some programs have stopped being funded. Certain types of programs are not as likely to be funded anymore. Prevention programs we found are very are on the decline of being funded in this state. For good or for bad, that's just, we're kind of able to watch the pattern of what communities are funding or what the state is funding communities to do as interventions for youth. So one last kind of word about this data set, and then I'll move on to kind of JGI's work on this. As we built the data set, we really had to be mindful of security. We also had to overcome some perception. So for a while, we had some programs, especially some of the prevention programs, really viewed this as kind of a repository of who the criminal kids are in the state. And we're like, no, that's not it. And some of that might be because it's housed at the Crime Commission, so that's a logical step. But we really had to reframe that this is meant for research purposes only. So if your child's name gets entered into the system, it's not, it's only for research purposes. Nobody else can access this. There's a lot of security around this. So in order to enter data, programs out in the field have to have a security certificate assigned to them by the Crime Commission, and then password protected and all of those. So those are installed by the agency, and then allows us to track kind of who entered data or deleted data. But there's also other privacy considerations we had to take into account. For example, we collect a lot of school-based data, and so we had to work closely with FERPA and the Department of Education at the national level. We got some feedback, and at our local Department of Education on whether or not we qualified as an exception to FERPA. Which we do because of the way it was written into statute and the fact that it's meant to design to improve programs. So there's we fit into a FERPA exception pretty nicely. We had to do the same kind of analysis with HIPAA, and really all of these we involved the University Council, the Nebraska Crime Commission's attorney, and then sometimes programs or the school superintendent or the attorney through education. So we've had a lot of attorneys kind of weigh in on this. So this isn't just JJI's analysis. We had lots of kind of legal opinions and briefs written about this to ensure we didn't ask people to collect something and have it be a violation of FERPA. Okay, so moving on now. Once this data is all compiled into, the program is sitting out in the field and they enter data on the diversion program, the truancy program, and their alternative to detention. So they enter hundreds of cases. Those all go to the Crime Commission and a secure platform. But really that still doesn't get to the question of whether or not something's effective, right? This is still individual level data. So that's really where JJI comes in. And what JJI does is we request an extract from the Crime Commission, and then we clean that data and we merge it to other data sets. So the Office of Probation has a data set, the court system where the cases are filed in court or dismissed, sometimes filed and then dismissed, but we were able to trace these cases at various points in our legal system. And that really helps us begin to answer some of the questions about effectiveness. So if you think about it, we can take most of our cases now and evaluate whether or not they've had subsequent law violations, and whether or not those were filed in court, and what type of law violation that was, and whether or not the youth ended up on probation, and whether the youth was successful on probation. But if you're a mentoring program, that might not be your most immediate outcome that you're trying to measure. So we really worked with programs to kind of capture outcomes at all the different levels. So that long-term goal of reducing recidivism is great, and that's what's written in statute. But you also might want to measure the strength of the relationship that helped the youth get to that point where they're law-abiding, and how many years that youth had a mentor. So each of our screens is really unique and designed to capture specific types of programs. Having said that, we still struggle with data and getting good data inputted at the community level. So every quarter, there's a report that comes out where the agency can see what % of their data was added or entered correctly. And there's always more data that we can collect. So JJI does a number of program evaluations, and some of them are better than others. Like one of them I wrote on alternatives to detention had so much missing data, I just still cringe at that report, but you can go look at it. It's online. We've kind of been very transparent about, when we have data that's not good, it's an opportunity to learn and to show programs, like if you're not collecting good data, you'll never be able to show that you're successful. So we really tried to bring these back. The process is JGI will merge the data sets, write the report, and then we send it back to the people running the programs first. They get a first shot at kind of reviewing what went into the report, and that's got two purposes, right? So they can say, wait a minute, I had more than 5 cases. So they can kind of check our work, but also it's they get the first read of whether or not they're effective. So they get to kind of read it and agree or disagree first. And then that goes on to the Crime Commission, and then it's parked out on our website. So you can go out and access a number of program evaluations out there. Some of them are written more like at the county level, so you can see they're more in table format, and you can see which programs are successful based on recidivism, and then you can compare that to different counties. So you can look at this data a lot of different ways, and then you can look at it at the program level. We also do some shorter policy briefs, and these policy briefs are usually around a topic that's cross-cutting, so something that maybe multiple programs are doing. So let's say one of these is on drug testing, and many programs may think that it's a positive if you drug test every youth that comes through your door. So the policy question is that a good use of funds? And so we have shorter policy briefs out there that kind of attempt to answer some of those questions based on the data that we collect in the state. So this all sounds super simple and smooth, but it's not. I guarantee you, we still struggle with getting good data. Sometimes we'll go on site and find out that an agency has been using, a particular field in a way that's not at all the definitions. All of our definitions are out online, but that doesn't necessarily mean everybody's pulled them down and taped them to their computer and uses them like gospel. So we try as much as possible to have kind of this ongoing dialogue with communities and to reach back out to them regularly and make sure that we're all using definitions the same way. This spring, we're supposed to start a data integrity team that will have a lead graduate student that works with some interns and goes on site. Well, I don't know if we'll go on site now, but reaches out to the program and kind of randomly selects some of the terms to see, are we using these terms the same way? And then we'll check the data system to see if those are in fact getting entered that way. So we do this when we request a data extract. A lot of times we can see when data is not being entered well. So, or if it's blank, right? You can see like if a program has left the race and ethnicity fields completely blank, then that is a big miss that we can't analyze the data. We can't look to see if certain groups are more successful than others and why that might be happening. So we try to do extracts very regularly, but we usually pull them by a certain program type. This whole project has been really beneficial to have it housed within a university because it allows us to, we use interns a lot. I shouldn't use the word use, but they would agree. It's been a great opportunity for interns. They get to go out in the field and work in a lot of these different kind of programs. So work in a county attorney's office or work in a nonprofit that's, helping improve mental health of students and youth. So it's been a really good arrangement, but the interns really help us a lot with entering data and making sure. So let's say you have a program that has had a lot of staff turnover and you finally get, new director and they're like, oh, I really want to clean up this data, but I'm so busy. I can't go back 2 years and fix all this data. We frequently will offer to have an intern come on site, and they can just sit there at the person's desk and pull those files and enter that data. So it's been a really nice arrangement to have this through the university. But it is an ongoing cyclical process, and there's an expense to that. So sometimes when we're entering data, we realize, oh, we need more fields in the screen, or we need to change something. And like I said, that sometimes has been a source of frustration with some of the programmers who we've worked with, because if you don't see that this has got to be a flexible, iterative process, you might want it to be like done and set aside. So it doesn't really work that way. I've gone through everything, and we should have some time for questions now.